All right, so we're going to go ahead and get started here. So thank you everybody so much for joining us this morning. Today's webcast titled Coordinating Care in Crisis, Addressing Administrative and Logistic Demands is being hosted by us here at the Institute for Disaster Mental Health at SUNY New Paltz with support from the New York State Department of Health. My name is Andrew O'Mara, and I'm the program manager at the Institute for Disaster Mental Health, and I'll be moderating today's event. In addition to our presenter, I'm joined this morning by the Institute for Disaster Mental Health's operation manager, Chrissy Lawler, who will be assisting with today's webcast as far as tech questions, that kind of thing goes. Each year, the Institute for Disaster Mental Health and the New York State Department of Health partnered together to bring you this web-based training focusing on the various aspects of disaster response and recovery. This year marks our 12th year that this webcast has been offered through this partnership, with over 150 participants having registered for the event this year. And each year it just grows bigger and bigger. For this year's webcast, we'll be examining some of the more administrative components of resilience planning and emergency response. Although maybe not the flashiest part of hospital emergency planning, thinking through these logistical challenges and how to best support staff while maintaining continuity of operations can be so invaluable once a major event begins to unfold. This includes taking time during these blue sky days to plan for the potential needs and obstacles that might be faced and to practice the skills and techniques that you anticipate will be needed to overcome these response challenges. With the goal of planning for these events before they occur, we will learn from an industry expert this morning about what hazards we should be planning for, how hospital systems might be impacted by these hazards, and what we can do now to better plan for these events accordingly before they occur. Just to cover a little bit of housekeeping before we go ahead and get started this morning, we will save some time to address any questions that you have in today's webcast. However, throughout the presentation, if you do have any questions, please feel free to add them to our Q&A feature here on Zoom so that we can be sure to address those during our Q&A session at the end of today's presentation. If you have any issues during the event, any tech issues, anything like that, please do utilize the chat function in order to get in touch with our team, who will attempt to help you address those issues as best we can. If your Zoom account is listed as something other than your name, please do write your full name in the chat so that we can confirm your attendance. Essentially, what we're going to do is download that copy of the chat and include that with our attendance list, just to make sure we include everybody. For those of you who might not know how to access that, if you go to the participant window at the bottom of the Zoom window, you should be able to check your name there. Today's webcast is also being recorded, with the recording being available to watch on the Department of Health Learning Management System shortly after the webcast finishes. Any logistical questions before we get started, you can go ahead and put those in the Q&A. Chrissy, is there anything that I missed before we go ahead and get rolling this morning?
Nope, you did a great job.
Okay, great. So as I'm sure that we are all too familiar with, hospital systems face a very wide array of hazards, ranging from cybersecurity threats to infectious disease outbreaks, severe weather events, and supply chain vulnerabilities and aging infrastructure, to everything in between. In 2015, the Hospital and Health System Association of Pennsylvania, or HAP, conducted a comprehensive review of hospital emergency management programs across the Commonwealth of Pennsylvania, supported through funding from the ASPR COVID-19 grant program. This review assessed the current structure, resources, and experience and needs of Pennsylvania's hospital emergency management workforce and programs, and has identified opportunities for improvement in this increasingly complex threat environment. The report, entitled Hospital Emergency Management in Pennsylvania, an Objective Review, aims to guide hospital leaders, state partners, and emergency management personnel in building more resilient healthcare systems and enhancing preparedness through professional development, expanded adoption of emergency management program metrics, and improved statewide alignment on emergency management initiatives. We are joined this morning by our webcast presenter, Edward Worcester, Manager for Business Continuity and Cyber Resilience at HAP, who will provide us with a detailed examination of this report, including its principal findings and the opportunities identified to strengthen emergency management within this very important healthcare sector. Although the scope of the review centers on Pennsylvania, considering how the insights and conclusions presented are relevant to your healthcare organizations throughout New York. I know in our pre-meeting, Ed and I were talking a lot about what the findings of this report say. I think there's a lot of things that impact us here in New York, and so I think there's a lot of sort of transference that we can have here. Ed Worster joins us today with a very extensive background in emergency management through both the healthcare and the energy sectors. Ed is a former chief physical security officer at PPL Corporation, a leading investor-owned utilities company in the U.S., where he has shaped corporate emergency management, business continuity strategies, executive protection, and physical security programs, protecting over $39 billion in assets. Recognized by the U.S. Department of Homeland Security as a master exercise practitioner, Ed has designed and executed numerous multi-hazard exercises throughout the United States, fostering resilience and readiness in the face of adversity. Internationally, he has also collaborated with government and public safety officials in Canada, Panama, South Korea, and Turkey, elevating emergency response capabilities and enhancing preparedness measures across the globe. Ed holds a master's degree in public safety management from St. Joseph's University and has augmented this experience through the prestigious programs such as those through the University of Pennsylvania Wharton School Security Executive Program and the FBI Graduate Domestic Security and Executive Academy in Quantico, Virginia. Worcester also holds certifications as a chartered security professional, certified emergency manager, certified healthcare safety professional, and a certified business continuity professional. So he really brings a lot of perspectives to the table this morning. Currently, Ed is the manager for business continuity and cyber resilience for the Hospital and Healthcare System Association of Pennsylvania, where he's provided consultation, collaboration, and support to healthcare stakeholders throughout the Commonwealth. So Ed, I'd love to turn it over to you. I think we have a lot to learn from your expertise here. So I'm going to take a back seat here, give the floor over to you, and please get us started.
Yeah, thank you, Andrew, and thank you, Chrissy. Appreciate the opportunity, and thank you all that have joined. Looking forward to having essentially a conversation with you today around this assessment that our association did with emergency management professionals in healthcare across the Commonwealth. And have to echo exactly what Andrew said. While this was definitely Pennsylvania focused, I think as we go through, you should be able to see some of the same challenges, some of the same opportunities, that you have in New York. When I was thinking about this presentation, I think about almost anything that goes on in Pennsylvania, potentially or essentially on the eastern side of Pennsylvania, has some nexus to New York, and I'm in the Poconos, so I am not far from New York. So I think a lot of similarities, and I hope to be able to, bring them to you today. So just objectives. Hopefully, before we get done, you'll have a good understanding on what some of the key threats and risks are, and also workforce trends. I think a lot of our conversation these days is around the workforce, whether it's nursing, whether it's technical support and cybersecurity, or even emergency management. There's definitely challenges getting qualified people. And as we all know, healthcare is very different from being a municipal emergency manager or even an emergency manager in other industries. I'll talk about some of the evolving threats. Certainly we learned a lot from COVID. I think COVID kind of opened up not only healthcare's eyes, but just general industry as to what the risks are and how to be prepared. And while I think, and I like to say I had a great pandemic plan because the first half of my career was healthcare, that pandemic plan by about, mid-March, the end of March of 2020 was kind of out the window. But just talk about just some of the other things that our report kind of highlighted. Some of the different hazards that are out there, training pathways, professional development. How do we continue to make sure that, we're prepared for the emerging trends and issues and other things that, present themselves to us in an ever-changing and dynamic environment. Talk about some program metrics. So one of the things that I did, I like to focus on maturity models. So the NIST cybersecurity framework maturity modeling is something I've worked with the last 12 years in the energy industry. And when I first read this report at HAP, the first thing that popped out to my mind was, wow, if we could develop from the data we received here, a maturity model and allow hospitals to take that information and do a self-assessment of where they are against some parameters, that would be beneficial for strategic planning, certainly would help develop and enhance resilience practices that are already going on in the hospitals. And then I also think, might help with budgeting. If we can show leadership, here's where we are from a maturity model perspective. Here's how we can get there and what some of those associated costs might be. So definitely interested in any feedback you all may have as we get towards the end. Talk about metrics and maturity models. And then essentially just talk about opportunities for improved collaboration. How do we make sure that we have the right stakeholders involved? And I think one of the things I really want to kind of leave everyone with, if nothing else, have a conversation in your organization. Break down the silos. I have a blog getting ready to come out sometime this year where I talk about turning silos into pillars and the pillars of strength for your organization. So, hopefully when we get done, I will have invoked some thought and hopefully some conversations in your organization. So as Andrew had mentioned, so we worked through a grant with ASPR and the hospitals and the emergency managers across Pennsylvania. And when you hear later on, I'm going to talk to you about some of the things that we do at HAP. One of the things that we do is we have a weekly briefing. Ours is this afternoon with our emergency management partners across the hospitals and health systems of Pennsylvania. And we talk about just unique things, what's gone on in the past, what are some of the hot topics that we're seeing, are there any watch outs, training. We want to be envisioned as a clearinghouse and kind of the go-to for information. So I think as we get through, you'll see where we play a unique role in the hospitals and health systems across Pennsylvania, in that we have a cadre of 6 emergency managers to provide support for them. Some of the key things and key themes that came out of this report, from a broad hazard perspective, certainly we know that cybersecurity is a big challenge. We're seeing data breaches, ransomware, business email compromise, all different types of factors. And one of the things that I really want to kind of instill in folks, and I've done some presentations in the past year on this, particularly with emergency managers, cybersecurity is not just an IT issue. It's if you have a cyber incident, it really impacts all of your operations. So, figuring out how we all work together and collaborate and what our roles and responsibilities may be in cybersecurity. We certainly know infectious disease will continue to be challenges that we face. Severe weather, I think there is no doubt that we continue to see weather trending more towards greater severity. Quick burst storms that have a significant impact on utilities and other infrastructure that really kind of impacts us in healthcare. And add to that aging infrastructure, whether it's the critical infrastructure that supports our facilities or the critical infrastructure within our facilities. Aging, keeping it up to speed, those were some of the challenges. And then supply chain risk. And one of the things I want to throw in with supply chain risk is the concept of third-party risk management. I think, part of the risk with supply chain is certainly understanding what some of those inherent risks from the vendor are. Their ability to deliver, their ability to keep our data safe, all of that stuff. On the EM workforce, staffing capacity, and really also looking at just holistically healthcare. We know that nursing's staffing is a challenge. So lots of different things to take a look at, all the responsibilities that go along with that, training resources, access to them, time and effort to get training done. So I think, workforce is a big thing. When I did business continuity planning for the energy company, my business continuity strategy focused on 4 areas: workplace, workforce, IT, and critical supply chain. So not surprised to see those areas really kind of hitting on the key themes. The evolving role post-COVID-19, we certainly, I think, showed our resilience, our resolve, our ability to adapt. That I think has long been a tradition in healthcare during COVID-19. But we also saw some opportunities for improvement, better coordination, better communication, continuity, thinking outside of the box. You know, healthcare, energy, a lot of industries, you know, there are some tasks that people could work from home. But you know, we can't fix people. We couldn't fix power lines and stuff like that, you know, from our living rooms or our home offices. So certainly a lot, you know, to learn from COVID-19, and as we should. After action reviews, improvement plans, looking to how we could take some of those lessons learned and build them into our programs. The key highlights for opportunities to enhance that came out of the report, certainly professional development. Where to get professional development? What track do you take from a professional development perspective? What are some of the courses that are out there? I teach in Pennsylvania for fire and emergency services, and one of the things that I always say is, it seems like even as well connected as I am in the industry, that there's always a great training program that I read about on LinkedIn a week after it happened. So how do we best make sure that we communicate what programs are available and you know, make sure people can get enrolled in those programs? I mentioned program metrics and evaluation before. I think there's some great opportunities there. Statewide alignment, ensuring that we're connected and that we're communicating and that we're collaborating. I met with a hospital leader in southeastern Pennsylvania, and in the middle of the conversation, he said a very profound statement, and it's a very one of the very large systems, and he said it's our responsibility to ensure that we are sharing information across the health sector, and that includes our rural hospitals, you know, our economically challenged facilities, that kind of stuff. So I thought that was a very good statement, and you know, I think that it's something that we can definitely continue to work on. And it's support for emergency management professionals, listening to them. What are their needs? What are some of the concerns that they have? How do we best address you know, their concerns? And as Andrew had mentioned, while these insights are Pennsylvania focused, I definitely think that they are broadly applicable across healthcare systems in the United States. And in fact, some of the topics I think are even global if we get into workplace violence and some of the targeted threats. So what is our current threat landscape? We know if we're dealing with even outside issues from healthcare, our threat landscape is constantly changing, and dare I say that we are in, I think, some uncharted territory and some uncharted times. So that ever evolving threat environment, we're certainly seeing greater increase in the frequency and severity of disasters post 9/11. And you only have to go a few years back. I don't ever remember seeing as many windstorms and you know, wind threats and you know, significant damage from winds as we've seen in the last handful of years. Certainly cybersecurity. You can't turn on the news. You can't look through any of our professional communications and not see some risks of cybersecurity. And certainly as we move to improve technology and you know, leverage technology advances like AI, certainly the cybersecurity threats increase. We know we have the ongoing terrorism risks, geopolitical events, the impact that geopolitical events have on all of our operations. Certainly, we've seen impacts to supply chain, you know, from trade matters and stuff like that. So being aware of some of those. Just the growing complexity and cost of emergency management. When you think of some of the tools that you're responsible for these days, effective mass communications, whether it's business continuity management tools, emergency management tools, patient tracking systems, there's a lot of costs that you know, are involved in not only operating the hospital, but then also the emergency management components, and then the greater emphasis on technology and community resilience. You know, we have emergency planning, we have emergency operations, you know, we have preparedness activities, business continuity, cyber. We're really starting to move towards the concept of resilience, and that is the ability to really kind of power through you know, adverse events as they happen in our organization. So I think holistically, we understand the concept of resilience. How do we operationalize that in our organizations? I think is something we definitely, you know, want to focus on. Hospital vulnerabilities, you know, the expanding risks that impact continuity of care, whether that's staffing, supply chain, infrastructure issues, those kinds of things. We've seen demands on our systems continue to increase. And I think it's interesting, in my area, you can't drive more than 10 miles without passing a hospital and urgent care, that kind of stuff. And I think it's great those opportunities are out there. And I think what's interesting is you tend to think, well, that'll probably alleviate emergency room waits or wait times in other areas. And I don't see that happening in a lot of places. So certainly seeing a lot more demands on our systems, and that has a ripple effect across the disciplines in our organizations. Multi-hazard type impacts simultaneously. So I think one of the common examples there is if we have significant weather, we often see impacts to our roadway infrastructure, whether it's bridges, whether it's roads, certainly our electric and energy infrastructure, all creating ripple effect or collateral impact hazards to our organizations. Preparedness requires sustained investment in resources. And, we continue to see challenges. The Hospital Association of Pennsylvania, our CEO, has recently just put out, some statements around concerns of funding for hospitals and where that is. So, just that general category has that ripple effect across the organization. Certainly, public health emergencies. COVID-19 exposed some system-wide vulnerabilities, and not necessarily within hospitals, but then also some of the other healthcare providers, long-term care, assisted living facilities, dental. So a lot of different healthcare providers certainly saw some challenges. And when we look pretty much at what some of the systems to provide support to us out there, such as ASPR and CMS and state associations, a lot of times they're focused on hospitals and health systems. So, think about long-term care, think about assisted living, think about some of the other, healthcare providers and how that can impact us on the hospital and health system side. We know that ties right into patient surges, supply shortages, infection control practices, access to personal protective equipment, medication stockpiles, that kind of stuff really, I think, was front and center in our battle against COVID-19. And certainly future pandemics remain a persistent threat. Hopefully we won't see in our lifetime something, as impactful as COVID-19, but I think we've seen a significant flu season. And who knows what's coming down the road for us. I mentioned natural disasters. We are seeing much greater frequency, intensity, impacts to our facilities, interruptions to supply chain. And when we think about our planning assumptions in emergency operations plans, a lot of times we haven't thought about, multiple impacts from one type of event. So, you think about severe weather with flooding. We could have power outages. We could have communication outages. Saw a presentation from a rural hospital in Pennsylvania that was essentially cut off from massive flooding. Staffing issues when people can't get to and from work. So lots of different challenges that can really have a significant impact on our plans. And building back on what Andrew said and kind of the disclaimer I put at the front, these are all issues that impact all of our healthcare facilities, whether you're in Pennsylvania, New York, California, Oregon, wherever you may happen to be. Cybersecurity certainly was no surprise to see this come up in our current threat. We know that hospitals and health systems prime targets for ransomware, hacking, business email compromise, other types of disruptions, whether it's DDoS, everything that's potentially out there from a cybersecurity perspective can present itself to us in the hospitals, and that can impact our infrastructure. It can impact our communications, our ability to continue to deliver care to patients. So, thinking about those concerns, and if you take nothing else away, take away from it that cybersecurity and cyber risk is an impact to all of us in hospitals, not just the IT department. And it takes a robust cybersecurity and response plan and planning to be able to overcome those issues and those challenges. And that is a multi-pronged approach. That cannot just be the IT department. Workplace violence, goes without saying. We have continued to see an increase in healthcare, other industries. I've done some work in the transportation industry, and they are seeing unprecedented levels of attacks on bus operators, train operators, and other staff. So certainly seeing a lot more violence. We know that healthcare workers are likely to see 5 times more workplace violence. I just saw a report out yesterday, shared it with the hospital systems in Pennsylvania around targeted executive threats. And healthcare and pharmacy, they lump them together. They make up 7% of the targeted executive threats. Not as high as some of the others. One of the concerning factors in that report was that healthcare and pharma leads the percentage at 84% for targeted threats that end in fatality. So just some scary numbers when you think about it. High rates of verbal and physical assaults. We certainly see numbers that are out there. I think the thing that concerns me, a lot of other healthcare providers, how much of it doesn't get reported, how much of it is just, well, that's just comes with the duty. When in all reality, it doesn't. We should expect to be able to go to work and not be harassed, not be assaulted, that kind of stuff. And we know that the violence impacts morale, care quality, staff retention. The whole concept of being a provider, doing something positive, really kind of gets eroded if we're faced with verbal threats, physical threats, that kind of stuff. And we are seeing that globally. So that is a significant issue. Mention aging infrastructure, outdated systems, whether it's your HVA systems, your other systems, electrical, those kinds of things. And being dependent upon them as part of our planning is something that we have to be concerned with, and understanding what are some of the challenges with your backup systems. Have they been tested? Are they well maintained? How long will they last? Have you practiced your backup processes? If you're using paper forms in a backup, have you figured out how to get them distributed? Does everybody know how to use those? I think back in the 90s when I first got into healthcare, we had paper forms printed out all over the place, as part of just kind of the regular work environment. But as we've moved from paper forms, are people familiar with how to fill them out? And then ultimately, how do you get all that information back into your electronic systems when the event ends so you can get paid, so you can, track the medical records of individuals? We talked about supply chain vulnerabilities a little bit before, but just the global dependence that we have on availability of materials, supplies, that kind of stuff. It's impacted by geopolitical threats, trade issues, transport issues. We're really seeing a lot of concerns around supply chain. So how do we best address those? Are we aware of those risks? Are we staying on top of it so we can start to forecast if there are issues? When H1N1 hit, I was working for a large suburban Philadelphia health system, and I remember when things got shut down in Mexico, if you remember back to H1N1, and I remember walking around with the medical director, who I was one of my dual reports, and we went to every unit and we asked them what was their critical supply needs. So in essence, if they had to triple their patient load for a week, what supplies would we need? And then we went and ordered them. And while H1N1 was impactful, we didn't end up having to use a lot of those. However, there was some catheters, some cardiac catheters that went on a national back order, and we had boxes of them. So think about that. That was more luck, I think, than anything else. But think about supply chain. What are some of the risks and how you can overcome them? The workforce shortages. seeing vacancy rates vary across organizations, but we're certainly seeing an increase in vacancies with nurses and support staff. And we know that those worsen when we're dealing with emergencies, surges, if there's other things going on. A lot of times we end up with that perfect storm of collateral incidents and impacts. So thinking about what our plans are around that, and how do we address our workforce shortages? What are our contingency staffing plans? How are we able to best adapt to that? Are we able to use technology? How efficient is the technology? What are some of the risks associated with that? I was at a technology conference and fascinated to see where healthcare can potentially go with technology. In my mind, though, I'm thinking, I'm unfortunately one of those doom and gloom thinkers all the time. I'm thinking, what happens if there's a cyber attack and you're using technology to support staffing? How do you address those issues? Certainly, there are issues that would have to be considered. And just your general overall preparedness needs. Complex and growing risks. We're seeing that at a time where we're seeing, constrained budgets, constrained staffing, supply chain issues. So we're really seeing the need to be able to have a good preparedness place or plan in place. And then also that good cross collaboration. I liken it to when there's a supply chain shortage, are you activating elements of your emergency operations plan? Are you addressing it like it's an incident and applying incident management principles? So I think there's a lot of things that we can leverage that we already have in our organizations to help us deal with some of these current and I would say ever evolving and emerging threats that are out there. Some of the Pennsylvania risks, similar to national healthcare, geography, climate, population density increases, that has a direct impact on the hazards. We've already talked about the different emergencies that we're facing, and then also really that need for community resilience. Flooding, number one hazard in Pennsylvania. We've seen significant impacts from it over the years. Some of our flood-prone regions, Pittsburgh, Harrisburg, any of your river basin communities, the Susquehanna River, so through central Pennsylvania, certainly the Southeast sees its fair share of flooding. So really can't go to too many sections of Pennsylvania that aren't impacted by flooding. So thinking about not only the impact of flood on your facilities, but then the impact that has on transportation and the ability to get supplies, people, those kinds of things. Severe weather risks, certainly seeing more heavy snow. I have about 18 inches of ice-packed snow outside of my house. Tornadoes, I can remember not seeing tornadoes as a kid, and now it's something that has, I don't want to say come to Pennsylvania, but we're certainly seeing some more tornadic activity in more recent years. Snow, ice, certainly some impactful storms and the associated collateral impacts that come from those. Hazardous materials and transportation risks, certainly globally, or at least across the United States, we've seen rail network issues. And if we look through our communities, we have massive transportation routes. In fact, a lot of the same transportation routes that are risks in Pennsylvania either come through New York, our destinations to New York. So there's a lot that goes on kind of in our little geographic area that we share. So being aware of that, what are some of the impacts that we can expect to deal with, whether it's decontamination, from a patient decon perspective, if our hospitals are impacted from a shelter in place or, forbid a evacuation situation. So understanding that collaboration, that multi-agency coordination is everybody on the same page. I will say, from my energy days, one of the things that I thought was always kind of the mystique was the whole concept of power restoration and really what goes on. And having had the opportunity to experience that, to manage storms for a couple of years, it gave me a lot of great insight as to, how other industries are impacted and how there really needs to have that multi-agency coordination. So thinking about how we do that. Pennsylvania, we've seen hospital closures and the impact that goes with that. Certainly collateral impact. When you see hospitals close, the hospitals, that are around them are going to see that impact. So that strain, looking at the economics and the workforce impacts that evolve, in communities. And then the ultimate vulnerabilities. How much further are people traveling for care? What are some of the associated risks? Now add that whole concept of flooding, other roadway conditions. We really see how, a lot of times we just either narrowly avert or we do end up in some type of multi-situational, multi-event disaster. Different preparedness challenges, and recalling that this came from our emergency management partners in our hospitals. Hospitals have to rapidly activate emergency operations during crisis, and I think one of the big things to think about with that is recognizing that a crisis is either on the verge of happening, or if you haven't seen that and it springs itself upon you, being able to react quickly. So thinking about surge capacities, your flexibility, the uncertainty of real world events and how that kind of, has an impact on us. Is it going to impact us? Who's keeping an eye on that? In amongst everything else that you have to focus on during your day. And then regulatory requirements. It was interesting, and you'll hear as I go through, one of the opportunities is even getting with regulators and understanding how regulations can impact our emergency operations. And are there opportunities to update some of the regulations to better reflect the emerging risks that are out there in healthcare? So figuring out some of those. And then a big role that HAP does an incredible job for over 100 years at is our role of advocacy. There are some barriers, and sometimes you need that advocate, you need that common voice that can represent, both in Washington and in our state capitals, to be able to talk about hospitals and the needs and, present sound cases to help, make sure that there's an understanding. And if there's an opportunity to collaborate, how do we best collaborate with that? So HAP does a great job. Things we're looking at in Pennsylvania. There's conversations around a rewrite of our Title 35, which is our emergency management regulations, and then just any of the other stuff around use of AI, cybersecurity impacts. Those are the kinds of things from an emergency perspective. Certainly, affordable care, funding for hospitals, tends to remain top of the priority list there. So what is the emergency manager's role? And it's interesting when you talk to colleagues across Pennsylvania, and I'm certain you would see this, across New York. What is their role in their organizations? How is that emerged? And where's it going, and how can we best be prepared? I think are things that we want to consider. So I think we know that our emergency management staff are essential. I think it's also important that when we can show that, it's important that we do that. So I think that's where the concept of metrics and maturity modeling, that kind of stuff, really becomes important. So we know that we're seeing expanding threats, pandemics, cyber attacks, terrorism continues to be there. And really, emergency management requires specialized expertise. I do a lot of work in assisted living and long-term care from an emergency management and fire life safety perspective. And a lot of times I'm dealing with a facilities director who's also handling security, safety, emergency management, all those different elements. Well, facilities itself is probably about a 110% job. So thinking about doing all those other things. We've just seen some updates with the Joint Commission, so constantly having to evolve to meet the regulatory and accreditation standards, understanding what they are, how do we best comply? And I think, one of the concepts that comes along with that too is realizing that if we do what's right, which takes knowing what's right. If we do what's right, a lot of times that regulatory compliance just comes along naturally. But we need dedicated emergency management professionals that understand the compliance, understand the complexities of how healthcare operates, understands the bureaucracy in healthcare, and that they're able to put together plans, response capabilities, training, all of that to make sure that we're staying on top of those emerging risks. Certainly, we know 9/11 highlighted a lot of needs, and I think no state knows more than probably New York from that perspective. We see their certifications out there. So, certainly CHEP is focused on healthcare, but the Certified Emergency Manager, the CEM, while it's broad focused, there are caucuses and groups within the International Association of Emergency Managers that are focused on healthcare. So lots of opportunities for collaboration, best practice sharing, those kinds of things. But much like nursing is professionalized and has certifications and standardizations. Emergency management has been doing the same thing, continuing to evolve. You may see that at a national or international level through an association. You may see that through a state level through like the State Emergency Management Agency. So there's a lot more to the emergency management role, particularly in healthcare. Risk assessment, incident command, recovery planning, after action reviews, lessons learned, all of that. And then add into it continuity and resilience. So being able to deal with, issues around technology, infrastructure, as we become more technologically advanced, ensuring that if there's an impact, that we either have a workaround for that impact, or we've built resilience into our systems that it doesn't have an effect on the organization or the patients that we're serving. Strong collaboration, public health, government, community partners, identifying who they are. I always tell everyone, from fire and emergency services perspective, local emergency management perspective, as much as you're concerned about events happening at your facility, they are equally as concerned, considering that hospitals, healthcare systems, healthcare providers fall into the target hazard category. So thinking about how you can build resilient systems through collaboration, who are those partners? How willing are you to share? And I think when we look at certainly Pennsylvania, we have a lot of events for the 250th anniversary, of our country. FIFA, the NFL draft. So a lot of collaboration, statewide to be able to deal with some of those potential impacts from those events. What are some of the core responsibilities today's emergency managers have? Putting together plans, procedures, and training, and not just putting them together and go, I'm good for the next cycle of surveys. They have to be monitored, evaluated, tested. People have to be familiar with what their roles and responsibilities are. So understanding how that ties in with continuity of care, patient safety, organizational resilience, financial stability, reputation of the organization. There's a lot of factors, that go into today's comprehensive emergency manager roles. Facilitating communications and collaboration. How can they be the link between external and internal stakeholders? And I think a big thing with that is identifying who your stakeholders are and maintaining that collaboration. Providing leadership during emergencies. It's interesting. Some organizations, certainly, in certain industries, there are emergency manager roles within the C-suite, and they, address emergencies. They try to figure out how skills that they have from incident management, risk assessment can help impact the entire organization. So thinking about where that role is and the leadership that they can provide. I did a presentation earlier this year on the emergency manager's role in cybersecurity incidents. And one of the things I said, as emergency managers, we have a great skill set. Our skill set, our ability to put together incident management plans, manage incidents, keep things on task, get resources. All of that are key. So when there's a cyber incident, stand up your emergency operations center and let the emergency managers handle unmet needs, communication, collaboration, coordination, while on the operations side, the IT teams are focusing on, fixing whatever's broken or impacted. Continuous improvement and readiness, healthcare, the concept of continuous improvement, quality assurance has always been there. It's a hallmark of healthcare. But emergency managers have a good skill set with leading post-incident debriefings, putting together after action reviews, lessons learned, improvement plans, those kinds of activities. And I think they can lend themselves well to other, I would say, non-traditional emergency management incidents. So something to leverage. Certainly mental health services are our colleagues at the Institute for Disaster and Mental Health, I think, do a tremendous job, a lot of studies there. And I think people are really starting to realize that mental health and empathy and those types of situations are very important. So being able to provide that, coordinate that, organize that for patients, families, staff, communities, I think is an important aspect. Drills and training, we have standard requirements for that. And even though we have standards, a lot of the stuff that's required for emergency management is just the right thing to do. So thinking about, the importance of that and how we can best, as emergency managers, support the overall organization. Certainly the concept of emergency management and organizational resilience programs being an insurance policy is something to consider. They function like insurance. They help reduce the impact of unexpected events, whether that's a physical impact, psychological impact, reputational impact, finances. They're all key. And I think what's interesting, I'll throw a concept out. Whenever I do training around incident management, one of the challenges that we face in today's 24/7 news cycle, where everyone is, a field correspondent with their cell phones, one of the concepts that really plays into how we're judged from handling an incident is the concept of artistic impression versus technical merit. Unfortunately, today, you can do everything technically right, but if you don't communicate in such a way that shows confidence and shows that you've done everything right, it's that artistic impression that people tend to judge organizations and individuals on. So understanding that and organizational reputation impacts and those kinds of things. I always used to think, the community hospitals that I was responsible for early on in my career both had maternity units. And I always used to say, hey, we don't want to be the hospital known for having a child abduction or issues around that. Because you're having a reputational issue. A lot of times they are very, very difficult to overcome. I think the other thing too is having sound emergency managers that can help coordinate response to all hazards really does give the leadership and the staff peace of mind. Confidence. I always say that a good hallmark of a solid emergency manager is that command presence. They can walk in a room and leaders go, "Oh wow, great, we got this handled." A lot of pressure on the emergency managers, I might add. I can remember sitting in board meetings with our CEO, and a question would come up about business continuity, and CEO, he would turn to me and he's like, "That's what we pay Ed for." And I'm like, "Oh, great. That's a lot of pressure." They also gave me the support I needed, so that was a good thing. I think it's important when we talk about insurance policy to ensure, that we provide an overview of how much value we bring to the organization, and correspondingly, what it takes for us to be able to deliver that value. So upfront investments and, whether that's training, equipment, supply, staffing, it does have an impact. And, in a few slides, I'm going to throw a staggering number out there. But minimal losses from downtime, liability, reputational harm. Even if you have insurance, insurance is an after thing. Hey, you might get some money back for that loss, but if we could prevent that loss, up front, we're gonna be better off. It's like, I've worked with our contract attorneys, in the energy industry, and a lot of times they would say, "Hey, well, it's in the contract. They have to do that." And I'm like, "Yeah, that's great. We can sue them for breach of contract, and that's going to take 10 years, or we could just do an effective job of risk management up front and avoid the potential issues for that." So thinking about how you can best show that a little bit of financial effort and support can be productive in preventing risks, really supporting quicker recovery and return to normal or a new normal operation sense. Overall, we see, potentials for long-term cost savings. Um, you know, if we could reduce the frequency and severity of disruptions, help see trends, help identify trends. If we do effective after action reviews and improvement planning for our organizations, we can help our facilities department justify infrastructure improvements. We can help others budget for, equipment upgrades or maintenance, those kinds of things. So really, we have a potential positive impact on the organization. And I think what's unfortunate, and I've seen, I actually was in a class on how to actually quantify what's essentially qualitative data, and looking at insurance costs, looking at deductibles and stuff like that, and really showing how being prepared can have a quantitative financial impact on the organization. But we know qualitative issues, morale, reputation, all of that certainly has a significant impact too. So thinking about how all of that potentially comes together. Staggering figure, $7,500 per minute. That's the average cost that hospitals face when systems go down. So, you can help when you're thinking about, giving some feedback on the investment of emergency management. That's a good number to throw out. Other studies show for every dollar invested, there's $4 to $6 in savings. Whether that's avoiding damage, downtime, efficient recovery, those are very important things. And cyber insurance. Even if you have cyber insurance, you want to make sure you understand your cyber insurance policy, because there are a lot of things that you have to do in order for it to, be enforceable, and in order for you to get paid for that. So what are we seeing in the future? What are some different things that we'd like to see as support? Thinking about our political landscapes, what are some of the other changes? What impacts our sustainability? And a lot of that can be uncertainty around funding, uncertainty around, the current management models. Those are all important things to think out. Being strong advocates. A community would not think, and in many cases, communities are required by law to have an emergency management function. So how do we best leverage, existing systems as comparisons to what we have in healthcare? Is there an opportunity for CMS to provide support, direct funding, or some element within reimbursements to help cover preparedness costs and ongoing costs? So is that a potential opportunity? And there's issues where, from an advocacy perspective, we can collaborate with. Is it possible to go to health insurance payers? Certainly payers benefit when hospitals are prepared and resilient. So is there a way to, maybe look at that? I think one of the challenges there is there's constantly conversations around just even some of the shortfalls, in some of the, some of the reimbursements that we already get. So thinking about that, is there some metric? Is there some other element within that process that can be leveraged? State grants and funding, and certainly within the last year or so, we've seen a lot of grant funding be kind of questioned. Are we going to see it? Are we not going to see it? Are we going to see it from a different agency? How are we going to best leverage that? So I think a lot of times, if you look at some of the information I've already talked about, metrics, being able to demonstrate value, all of that, that's information you want to put together so that if there's funding opportunities for support, whether it's backup systems, infrastructure, training, other types of stakeholder engagement between states and local municipalities, emergency responders, emergency type response agencies. If we could look at some of those opportunities out there, they're certainly worth leveraging and considering. Other federal funding. So looking at HPP, can there be direct subawards to hospitals? What are some of the things that can be done? Certainly, we know, there are some hospitals that have very robust, well-funded emergency management systems. But if there's resource or finance constrained organizations, how do we best ensure that they are able to at least deliver some par level of emergency capabilities for their organization? So being a safety net, looking at that opportunity, that's out there. And we know tied in directly with that is the importance of federal program stability. So restructuring, keeping an eye on that. How's that going to impact HHS, ASPR, FEMA, other organizations? ASPR just put out their strategic plan for the next few years. So looking at that, trying to interpret that, what's that mean? What's all this conversation mean? How's it going to potentially, impact us? Can we prepare now? What can we prepare for? And I think that's even a lot of the uncertainty and instability, that we're going to see. Hospitals have long relied on HPP and other programs to help support healthcare, emergency preparedness, and readiness. So understanding what are some of the risks associated with that, and are organizations ready to pick up any funding that might be lost as we see restructuring. Integrating hospitals into community readiness, I think a lot of this should already kind of be there, but understanding how can that continue to be leveraged. Is there cross-sector planning? What are some opportunities for resource sharing that might be out there? So thinking about, that kind of stuff. Getting groups together, putting together regional training and planning consortiums, is something that we see. Pennsylvania, one of the things that we're seeing is consolidation of volunteer fire departments, regionalization of emergency management organizations. So really starting to think about what are some of the out of the box thinking, or what's some other initiatives that are going on that we might be able to leverage in our organizations. Building a culture of preparedness, I think that's something that we all strive to. How do we measure that? What's our capabilities? What can we do to best make sure that we are positioned as a resource in our communities to be able to do that? So how do we get the best emergency managers, the best trained, the best, prepared for our organizations? We know that there's specialized training that's required. I'm working with a couple of colleagues that went from working as state troopers in an organization, and now they're coming up on their accreditation cycle with Joint Commission and trying to figure out all the different requirements. There's a lot of time, a lot of effort that needs to go into that. So understanding the training that they need, where they can get those resources, understanding how to navigate the healthcare systems. Sometimes that's not easy to do. I came up in community hospitals, have an affinity for community hospitals, and joined the camaraderie, but I've also worked in large health systems too. So figuring out how you can, best fit into your organization and understand all the different regulations. Then once you learn that, there's ongoing education. We just saw significant standards changes. How do they impact us? How do we operationalize those? So getting that training together. How do we collaborate with our partners? Who are our partners? How do we best leverage those opportunities? Thinking about some of the training programs that are out there, certainly the core incident management, IS 100, 200, 700, 800. I always suggest that's kind of like your foundational level. I think one of the nice things, there are some programs out there for just kind of boiling all that stuff down from an executive perspective. If you think about your C-suite's time, how do you best get in there and make the NIMS courses palatable, to be quite honest? And if you've sat through IS 300 and 400, you know exactly what I'm talking about. I would say emergency manager, someone in leadership roles, someone that has the potential for incident commander, probably wants to take a look at the IS 300 and 400. The nice thing about that is so many of our events have that potential nexus to carry into the community or have community impact. And that just kind of levels the playing field for us to be able to, talk with our community partners. A lot of good FEMA independent study courses that are out there. If you're interested, I actually have a good list that provide a track for what are the best programs to kind of go into. FEMA's independent study program, I've used that for years. It helps me keep my continuing education units up to speed. There's a lot of other good stuff out there. And, for some of the programs that I teach outside of healthcare, I call them tools in a toolbox. And this goes back to, one of my earlier comments. There's such great programs out there that a lot of times people they don't know where to go and do them. So TEACS, OSHA has stuff, the Center for Domestic Preparedness, lots of different programs, that are out there. You could leverage your community, fire departments. They have a lot of ongoing training requirements, and sometimes you might be able to piggyback or collaborate with them on the training. FEMA has a professional development series, great program. It's a series of courses. When you complete that, then you get the professional development certificate. In Pennsylvania, the Pennsylvania Emergency Management Agency, great partnership with them. They have a statewide competency baseline program for emergency managers. Has a prescribed series of courses, ongoing educational con ed requirements, that kind of stuff. Certainly amateur radio, Skywarn, lots of good stuff out there for you to take a look at. Mentioned before, the CEM, CHEP, lots of different programs that are out there too that you can, help. I always say get the credit that you deserve for all the years of studying and training and experience, that you bring. Certainly, medical and clinical disaster response courses that are out there, basic disaster life support, advanced disaster life support, hazmat training specific to, clinicians. And then in Pennsylvania, we also have a healthcare incident command system series, the HICS series, builds on the California program and kind of really brings some practical experiences to that. Not in our report, but other things to think out. Business continuity, disaster recovery. Certainly key elements. There's certifications that are out there through a couple of different organizations. And then the Texas Engineering Extension, TEACS, they have a great online cyber program that you could take. It's free. It's DHS funded. And I think what's nice about that is there's one or two programs that give you a good foundational level as an emergency manager to kind of understand where your roles and responsibilities may be in a cyber incident. Starting to get towards the end, program metrics. So one of the things that we really looked at is what's a good way to potentially show maturity of a program? And we do this. If you look all across healthcare, we always look at program metrics and quality assurance and infection rates and so lots of different things. Why shouldn't we look at program metrics? So looking at a consistent workforce framework, making sure there's alignment with the regulations that are out there. Metrics promote accountability, quality improvement, quality assurance. It's that plan, do, check, act, continuous quality improvement, and really can help look at statewide needs, if there's opportunities for an impact across all hospitals or health systems, but then also gives you the flexibility to look at local perspectives. Some of the core elements. And these are things that we got feedback from our members. And then, like I said, I've worked in accreditation in fire and emergency services for over 20 years and immediately took this data and created a maturity model that I'm hoping that we'll roll out and share, and maybe even something we pass on to our partners in New York for consideration. But some of the key elements: is there someone with appropriate training and external partnerships that's overseeing emergency management? Is your program comprehensive, all hazards? Do you have an emergency operations plan? Do you do hazard vulnerability analysis? Are you doing after action reviews, improvement plans? And then are you doing a multi-year training and exercise plan, like a 3 to 5 year plan? HCEP has a lot of tools for that. Do you have an emergency management committee that has regular meetings and has a leadership sponsor or leadership participating? Is there evidence of staff training, incident command competencies, plan awareness, some tracking that shows that there is some consistent training going on in the organization? Does your coordinator, do they have greater than or equal to 50% of dedicated emergency management responsibilities? I always say when I am advising people when they're looking for jobs, if you see a job where it's facilities, safety, security, emergency management, if you get that job, know that 90% of your job will be facilities. So looking at what's that level of dedication. Training, education experience documented. Once again, relationships with local partners. Ongoing continuing education that's required. So having a process, and as your maturity level builds, certainly there's a baseline, and then aspirational goals as you move through. Some type of mentorship program for partnering up emergency managers. I think in some industries the concept of mentorship has been lost, and I think that there's no better training tool, no better confidence builder than having some type of mentorship program. Talk about the all hazards, looking at a broad emergency management committee participation, having clinical, facilities, security, IT, regular meetings, continuous improvement, ongoing staff training, certainly are good elements. Regional participation. So making sure that there is alignment with healthcare coalitions or similar organizations. In Pennsylvania, we look at participation in our HAP emergency management program. So active organizational membership, attendance at equal or greater than 6 meetings or events annually. So showing that you're not only working internally, but then also those collaborations and partnerships. Doing an HVA annually, sharing that information, having some approval process for your HVA. Same thing with your emergency operations plan. Making sure it's all hazards, aligned, updated, approved through appropriate governance. So having policies and procedures, good governance around your programs. Talk about the training exercise plan, building it out, looking at your EOP, looking at your HVA. How do we best, maximize the time of our staff and, our resources? Some form of redundant communications, at least 2 communications platforms. Annual testing, staff competency training. Are you using GETS, WPS? Do you have a backup email system? So lots of different things, to think about. And is there ongoing testing and maintenance? Certainly that is key. Can't just have the systems and not test them. Having a COOP plan, COOP, business continuity. I wish we'd all get on one page with the terminology there. But same thing. Any of your planning, having a governance process that reviews and approves. I liked at the electric company that I worked for, we had executive sponsors for things. And for almost all of my programs, my executive sponsor was the CEO. So there was no question about it. So having that support, I think really does help. Having program certification or recognition. So, have you been declared storm ready? Have you met some standard that you've gotten recognition, for that? System wide, um, you know, if you have a health system, just really kind of taking those metrics and adopting it at a broader scale. So there's only a couple of differences, and one is around leadership. Having someone that's qualified that has a system leadership title and responsibilities, and then along with that is a system-wide EOP. So maybe a foundational emergency operations plan with annexes for different locations, having some annual system level exercise involving multiple facilities. Working for, right now with a large health system over a couple of states to do a large system wide tabletop exercise this spring. So stuff like that. Same thing, system level continuity planning. So a lot of times what I've seen with organizations is they'll build a foundational business continuity strategy and then have an appendix to that strategy, for each of their locations. And then even inside of that, individual departments and programs. So really the difference between the hospital level and the system level really is, if it's system level, having someone dedicated across the system, and then also having plans across the system. So starting to wrap up, what are the conclusions of this report? What are some things that are we're doing in Pennsylvania, and what are some potential call to actions? So we certainly know that emergency management staff are essential to our organizations. They bring a depth of experience. A lot of times I've seen nurses have gone on to become emergency managers. They really have a strong perspective. I've worked over the years with a lot of physicians that have incredible backgrounds on emergency management. And I know New York has a lot of professionals that, from a medical background, nursing background, that are engaged in emergency management, some of the best in the country. Pennsylvania, same thing. We have some very, very good colleagues of mine that do that. So looking at what that role is, understanding that emergency management is patient safety, cybersecurity is patient safety. So building out our resiliency programs. The growing challenges. We mentioned a lot of these already. Understanding the potential risks and impacts, being prepared, being ready to address emerging impacts. I think about in my community where I was a fire chief, flooding wasn't a big issue. We'd have a little bit of flooding here and there. And then September 8th, 1996, we had 10 inches of rain in 2 hours. So think about some of those emerging risks. Certainly, cybersecurity is a risk you need to think about. Don't need to go out and become a CISO trained and qualified individual, but having a good understanding of how you can best support that. And I think incident management is one of the key ways. Understanding, showing the value that you bring. All too often, we're viewed in emergency management and a lot of support functions. We're kind of viewed as a regulatory requirement. We're reviewed as a cost center, and not value add. But understanding how can we best show that we bring value add to our organizations, and really that concept of we're an insurance policy. You wouldn't think of not paying for cyber insurance or liability insurance, that kind of stuff. And by the way, we could probably save on premiums too if we do our job right and we have the right support. Final takeaway, effective emergency management, and I'll throw cybersecurity in there too, safeguards patient care during crisis. Extended beyond patient care, it helps provide for our staff, our employees, our visitors, our stakeholders. So we do play an important role. It also strengthens our community resilience, and not only locally but statewide. Hospitals are centers of communities, and when you look at how our mission has evolved over the decades and will continue to evolve, it's important to understand how important we are in the community. And just look at communities that have lost hospitals to closure over the years and the impacts that they have seen. It's an economic impact. There's far greater impacts. So if you look at that as an example, a lot of times that might help you drive some thoughts around this. So continued support, investing in the programs, is solid. What are we doing at HAP? We have focus groups. I work with the physical security focus group, and then we just put together technology, business continuity, and cyber resilience group. Looking to be the clearinghouse for information, data, when reports come out, case studies, lots of different things. As I mentioned, 1:00 today, every Wednesday, we have our weekly emergency managers briefing, talk about weather, what's going on in the geopolitical world, some of the risks, cautions, call to actions, that kind of stuff. We do a bi-monthly blog, and that's in our healthcare preparedness digest. I will have a QR code at the end here. You could connect with me on that, get signed up for that. It's all hazards, a lot of good stuff. I've done some of the blogs for that. Also, give you a link to my LinkedIn if you want to follow me. I blog and post on LinkedIn probably 2 or 3 times a week. All important stuff. I don't use it as Facebook, but good opportunities out there. We are working with our hospitals. We've done a number of workplace violence roundtable discussions where we've brought hospitals, law enforcement, district attorneys together to kind of talk about that, taking that to the next level this year. Expect probably later in the year some type of report to come out around that. We do an annual emergency management conference. Last year, we did a virtual career fair, workforce development. So it focused on, it wasn't all around emergency management. However, we did talk about cyber. And there's a big discussion, particularly in the health sector coordination council outreach group, around challenges of getting good cyber folks to join hospitals and healthcare. Some don't know that that's a career path. Some get discouraged by job postings that require significant experience to come in. So lots of different things. Talked about advocacy. We've been doing some work with long-term care through our subsidiary HAP Evolve, where we're doing a tabletop exercise series and some other programs. Some considerations, developing that maturity model, continuing to do webinars, podcasts, really looking to build off of COVID-19 and reach out to some of those other healthcare providers. And then hoping this year to be able to do some industry-specific education programs, healthcare emergency management and business continuity leadership academies, and just develop the program for CEO and board of director cyber resilience boot camp to really just kind of give them a high level. So my call to action, we need to strengthen hospital preparedness, prioritize the investment in emergency management staffing, training, and infrastructure, support the ongoing development of resilience in our organizations, taking it beyond our emergency planning, and being able to power through anything that comes up. Champion collaboration with state agencies, healthcare coalitions, community partners. Think outside of the box. How can you best leverage those relationships? Commit to continuous improvement through exercises, after action reviews, readiness metrics. Show your value to your organization. And I'll certainly entertain questions, and if we don't have time, can follow up. But preparedness is not a cost. It's a commitment to protecting the people who depend on us most. And I think it's something that we need to live to. So strive to build a culture of preparedness in your organizations, and best of luck with the continuing, evolving, dynamic communities that we find ourselves in. Thank you very much.
Thank you so much, Ed. That was fantastic. I also just put a link in the chat as well to the Healthcare Emergency Preparedness blog, as well as the HAP Evolve Healthcare Preparedness Digest. You can find that in the chat. And I am just now putting in a link to the full report. So if you do want to, look at that full report that Ed was talking about, you can do so at that link here. Looks like we have about 9 or 10 minutes left for questions. If you do have questions, please put them in the Q&A. We'll be answering those as they come in. Just a couple questions that I had and some that I saw come up throughout the presentation, Ed. First one being very technical. Someone was asking if they could get a copy of the slides. I just wanted to see if you would feel comfortable sharing that with us so we could send it out to the attendees.
Yeah, just let me verify with HAP. I don't think that'll be an issue because it's a summary of our public report.
Right.
So yeah, I don't see that being an issue. I think we'll be able to make that available.
Okay, perfect. Thank you. And so, so anyone who's looking for that, we'll make sure to get that to our contacts at Department of Health so we can add it to the LMS and to the notice that goes out when that's posted. And I know you mentioned, some of the sort of expanding responsibilities of hospital emergency managers and even some of the sort of, multiple roles that they play. What tasks do you see being most commonly added to that role of emergency management, or sort of how is that role expanding in the last year or two that you've seen?
Yeah, that's a great question. From my colleagues, what I'm seeing is that move to resilience, and a lot of them where they had been strict emergency management over the years, patient decon, that kind of stuff. They're starting to get more into business continuity of operations, collaborating with their cyber teams to understand what their role might be on that. So that's where I really kind of see, some of that going.
Yeah, and I'm sure the cyber stuff is always evolving, right? Especially over the last couple of years. So
yeah, and that's definitely from a couple of perspectives on emergency management. One, being prepared for cyber as a vulnerability, but then also a lot of today's emergency management systems, mass notification systems, web EOC, Javari stuff, programs like that. Obviously, you need connectivity to make those work. So that does become a challenge.
Sure. I was just saying, I was at a dentist appointment recently, and they had a power outage right as I was leaving, and they were like, "Well, our system is down, so we have no information. Sorry, why don't you call back, tomorrow?" So, some more questions that are coming in here. So I know you were talking about sort of the increase in funding for emergency management, how to sort of pitch that. I think that $7,500 a minute is a very powerful figure. But I was just wondering, what other figures or sort of arguments have you found useful in showing the need for emergency management and sort of selling that insurance policy, which I really like that sort of how you framed it that way.
Yeah, now another great question, and I think a lot of it comes down to how do you best demonstrate your value. So, being able to keep metrics, keep data, show where you are from a maturity perspective with other hospitals. And I think if you're able to look at situations where a real dollar amount could have been applied, say you did have a downtime and you saw maybe how much business you lost, or you're able to quantify that somehow, or maybe you had to pay an insurance deductible and then an associated premium. So there's some methodologies that are out there. I was at a presentation where they essentially, said, "Hey, create a spreadsheet. Here's some figures to plug in," and a lot of it is based around costs and showing, hey, if we have this in place, there's a good chance that we're going to be able to either one, reduce our risk, but then also reduce the financial impact, long-term reputational impacts, that kind of stuff.
Yeah, I think that was an important part that you mentioned too that I hadn't really considered, right? The reputational impacts as well, right? In addition to sort of the monetary ones, which is sort of harder to quantify, right? But I think we can all sort of understand what that looks like.
Yeah, I can tell you, a number of organizations that I've worked with, certainly the energy company, publicly held company. So reputational impact is significant. But also considering your program, a crisis management team or an executive crisis management team, because there are other aspects of an emergency, that the executive team is probably going to be, need to consider some other thoughts, particularly around crisis communication, stakeholder engagement, board engagement, that kind of stuff. So there's really a lot of overlap. So I think having that type of model also starts to show the value and really helps strengthen the concept of an insurance policy.
Yeah. Well, and that was sort of going to go to my sort of next question here is, how do you see, or how do you think hospitals should be reinvesting that money, right? If you're able to convince your hospital, hey, we should invest in this, how do you see that money best being utilized?
Well, I think one of the things you have to do is you have to show how that has an impact on other elements in healthcare that really do, and as they should, take a front priority, such as patient safety.
Mm-hmm.
So I think when you can align that investment with patient safety, organizational reputation, and I also think you always constantly want to be looking at value add. How do I best add value? Um, and I think probably the final thing that I always think of when I'm working with budgets, demonstrating that you're a good steward of the money. So when I say that, one of the things that I'm thinking about is, if there's not an opportunity to spend all the money, and I'm sure people are probably cringing as I say this, not being afraid to say, hey, we weren't able to do that. We're able to give some money back to some other things. So I think really understanding the budget process in your organization and how you can, best leverage that. And I think really you have to be able to tell a story. So telling a story is key to all of that.
Yeah, and I think especially too with some of the, and I'm glad you touched on this, some of the budget constraints that I think are very real, and sort of coming down the pipeline. So important to consider there as well.
Exactly. And one thing, don't use fear tactics. I've watched people think that they're doing a good job doing that, and they're like, well, if you don't do this, this is going to happen. And I'm like, yeah, that doesn't work. I think that approach went out years ago.
Yeah, yeah, not as effective anymore. So Ed, just to sort of close this out here, if there was a single most impactful improvement that you think hospital emergency managers could make within the next year, for instance, to help strengthen the resilience of their systems, what would you say that one single thing would be?
I would say communicate. I think, early in the presentation, I talked about my silos to pillars concept. And I really do think to make our hospitals and health systems, resilient and enhance our capabilities and deal with the challenges that we have, whether it's patient care, funding, all of that, it needs to be a collective conversation, good communication, understanding how the skills align, roles and responsibilities. And I think a lot of that is just open, transparent communication.
Yeah, I think that makes a lot of sense here. We just got one other question. Let me see here in the chat. What are you seeing as new steps or next steps to better integrate emergency health preparedness across the continuum of a health system that would better follow the state, federal, and industry resources that are trying to accomplish the delivery?
No, that's a great question. One of the things I think the concept of using regulations is a dual-edged sword, because I think regulations without funding is a challenge. I think if there's an opportunity to incentivize best practices, I think is key. And I touched a little bit on long-term care, assisted living facilities. A lot of times, if there's issues with those facilities, they directly impact our hospitals. So, I think I think that's going to be a challenge. Honestly, I think that's a challenge. I think if you could incentivize, best practices, certainly share best practices, continuing care retirement communities tend to have resource capabilities to be able to deal with that. But I think across Pennsylvania, across New York, across a lot of other states, are independent standalone facilities where it's it's competing priorities, and almost a fire drill. So I think there's some inherent challenges. I probably didn't do justice answering that. But I think it's a fine line trying to figure out where that is, to be able to do that.
Yeah, and I think your point too about communicating, working with external partners, helps us sort of break that down a little bit as well. Okay, great. So that's all we have time for this morning. So thank you again, Ed, for your time and your expertise this morning. Thank you everybody who joined us this morning for our webcast. As a reminder, the webcast is recorded. It will be available through the Department of Health Learning Management System. I believe they will email everybody who was here as well to let you know when that's been uploaded. And then, pending HAP's approval, we'll include the slides and all those other resources there as well. So thank you all for coming, and I hope everybody has a nice rest of your week.